today's question: how do we fall asleep? It seems like a simple question, but it has a very complicated answer. Just ask Dr. Lindsay Browning, sleep expert.
So falling asleep's got sort of two main factors. There's biological factors and psychological factors. So in order to fall asleep, our body needs to know that it's time for sleep. And that's where our circadian rhythm, our melatonin production, as well as our sleep pressure, which is our adenosine. Basically, the longer we've been awake, the more pressure, the urge to sleep we have. So those things need to be right, but also we need to be relaxed. So we need to be biologically ready for sleep, and then we need to be psychologically calm in order to fall asleep. And then as we start to fall asleep, our brain starts to go from its awakening brainwaves and logical thinking, all of those things, and our brainwaves change to a more relaxed mode as we start to fall asleep into that N1 light sleep phase.
Right, okay. Now, circadian rhythms, we know about those. They're the things that tell us when it's daytime, they tell us when it's nighttime, tell us when we should be going to sleep. So it's important that we get that in tippity-top shape so we know what's going on.
Absolutely. So we probably have experienced jet lag, and we'll know that our circadian rhythm is out of whack if we're in a different time zone. But what we might not think about is day to day, that we want to make sure that our bodies know the difference between night and day, then it's really stark. So that's where it's so important to get outside, especially if we can do and the weather is nice, to go outside, get some bright sunshine, because that helps our body to know it's daytime. And then we will produce lots of nice melatonin right before bed and help us to go to sleep quickly and sleep through the night more effectively.
What's melatonin?
So we think it's our sleep timing hormone. So we produce it sort of towards bedtime. We start to produce more of it, and it tells our body that it's time to sleep. So we might be, really, really, really tired, especially if we're jet lagged. But if our body doesn't think it's time to sleep, we won't be able to go to sleep. So those two things need to be, we need to feel like it's time for bed. Our melatonin needs to be there, as well as our body being tired to think, actually, we do need to go to sleep because we're just absolutely exhausted. Sometimes we don't. People with insomnia, they can feel absolutely exhausted, but they can't switch off and fall asleep. And that's really, really frustrating.
So when we fall asleep then, what's happening when that sort of process starts to begin? Because it feels like a gradual process. I don't know, it's like falling into a hole. 1 minute you're there and then the next you're not.
Yeah, and it's a gradual process. So when we're awake, we have our brainwaves and we're paying attention. And as we start to become relaxed, and we're still awake, but we're going towards that sleepy stage, our brainwaves change to a thing called alpha waves. And that's when we might be there, but not there. You're watching TV, but nothing actually is going in, or you're reading a book and your eyes are going over the words, but you think, oh my goodness, I read that whole paragraph, but nothing went in, because your brain is starting to switch off. And as we drift from that sort of relaxed awake into sleep, then our brainwaves change, they become even slower, and our body, our physical, our muscles start to relax. And that's why as you fall asleep, your head nods forward. So if you're in a boring meeting, you might be in a boring meeting at work, and your head just nods forward, and then you suddenly realize, oops, I was falling asleep, and you whip your head back again. And that's the falling asleep. Our body starts to become physically so relaxed that our muscles start to sort of lose their strength. So we become mentally, we're not paying attention, and our body starts to become all weak because we're falling asleep. And then that just continues, and then we're fully asleep and we're not paying any attention, and our brain starts to go into full sort of N1 stage 2 light sleep when we are not going to be woken up.
Right, I see. Now at that point, I understand you enter a kind of paralysis.
Yeah, so as we fall asleep, our muscles start to become weaker and weaker. And in REM sleep especially, which is where we tend to dream, our body is fully paralyzed. So we are not able to move at all, except for our eyes and our lungs, so that we can breathe, and our heart. And that's because how dangerous would it be when we're dreaming about running around and fighting people and jumping through buildings? If we started acting that stuff out, it'd be really dangerous. We'd be punching our partner in bed. So yes, when we're asleep, first of all, when we're in light sleep, our body is very, very relaxed and our muscles are quite weak. But when we enter REM sleep, we become fully paralyzed, where we don't move at all, except if it goes wrong. And that's where you can have some sort of sleep disorders where people might sleepwalk, sleep talk, start acting out their dreams. But that's actually because the part of your body that should be paralyzed and asleep and making sure that your body isn't moving goes wrong. So you're able to be sleepwalking, you're walking around, but you are still asleep. Your brain's asleep, but your body isn't paralyzed, and you start walking around.
One of the reasons we were talking about this as a Wikipedia was because we were discussing military methods of making yourself go to sleep. Because if you're like in a war zone or something, if you're in the armed forces, it must be really tricky to get everything that you need, to be relaxed, to make sure you're going to sleep at the right time of day. It must be very difficult to get that sorted out.
So obviously, it's easier to fall asleep when our body thinks it's the right time to sleep. But if you're in the army, in the military, and you need to get sleep when you can, it might not be nighttime, and especially you might not be relaxed. And that's the key thing, because if you imagine yourself in a war zone, you're not going to be all relaxed and calm. So it's the military sleep method is something that's sort of helping you as best as possible to be as calm and relaxed as possible to help you to fall asleep. And if you've read a lot about sort of good sleep hygiene, you've probably read about having a pre-bedtime routine. And that means doing something before bed every day to sort of tell your brain, yes, this is what we do before we fall asleep. So if you train yourself to do something like the military sleep method, which is a series of sort of physical and mental exercises that are designed to relax your body and relax your mind, that you associate that with sleep. And if you practice that, it can help you to fall asleep whenever and in whatever situation you are in, because especially, like I said, in the military, you might need to fall asleep now because you're going to be on a mission in 2 hours' time.
If I could fall asleep at any time, it would be a relief. But thank you very much indeed to Dr Lindsay Browning, sleep expert.